In this study, we looked at the hospital-based violence intervention program at Boston Medical Center, and we had a large sample of patients following up on their outcomes over 10 years. So from the moment that they were hospitalized with a gunshot or stab wound, we could see whether they engaged with a hospital-based violence intervention program, and if so, how much. We could also see their long-term outcomes up to 3 years, whether they were injured again in a violent incident or whether they used violence against someone else. And so what we found was, in our first test, we looked at just whether people had engaged with the program at all, especially in that first month after their initial injury, which is when they might be most motivated to engage. We found that just engaging once did not have effects on their long-term violence outcomes. That kind of engagement probably benefits them in other ways because the program addresses physical health needs and social needs, but we didn't see those violence prevention effects. However, in the second analysis, we looked at people who had sustained engagement over the first 2 months after their injury, whether they were coming in or working with the team at least every other week for those first 2 months. And in that smaller group, we found very large prevention effects. That group did much better over time in avoiding violent re-injury or the use of violence. So this is the first study with a big sample and strong controls that did find that the program is effective for violence prevention. And what it tells us is that that high dosage is something that really matters for violence prevention effects in these programs. That's important because, first, it tells us where programs should invest their resources if they're trying to prevent violence. They should be working to help clients to engage for longer.
And those who actually participate in the program, and the success rate was amazing. Like, it was eye-opening for us, and I'm sure it would instill a little fire in them to just know that if they utilize what's here, like take advantage of the opportunity they have, they can really turn the page.
We know that if people do their part and stay involved, that we will help them navigate whatever the barriers are to find greater outcomes. And, I look forward, to our continuation of that. We're pretty proud of the history of the program and pretty excited about the innovations that are yet to come.
This is also an important moment for this kind of research because programs like the hospital-based violence intervention program at Boston Medical Center and elsewhere, their funding is threatened by federal cuts. There was a large influx in funding for these kinds of programs during COVID and during the last presidential administration. A lot of that has been peeled back in the last year. So this is a really pivotal inflection point for these kinds of programs when it comes to the big federal funds that allow them to really execute their mission to the fullest.